dental schools.
I would think that that should be the most prominent text in karyology. It's an amazing,
I never heard of it
amazing
before.
book, so I'm
Yeah.
glad that you ran into a few new things.
Few things.
A few things.
A lot of things.
Oh,
A lot of things. Yesterday we saw a patient who, I think I did an extraction and a couple of fillings since I was down there. And yesterday he came in for 2 crowns. Completely deep, deep decay. And my whole story was different than it would have been. Before I read the book and before I came here, I said, we can't do these crowns. What's the point? If we do the crowns, you're just going to decay on the part of the tooth below the crown. So we just did big build-ups, and I had a big conversation with him, and we'll see.
Okay, controlling the disease.
No point in doing the crowns unless he's going to change his lifestyle, stop creating an environment where he has decay in his mouth.
Right.
I don't, kind of a cowboy type. I said, maybe you can have a toothbrush in your hip pocket instead of a checkbook or 2.
So where
I don't
was
know
the
if you
sugar
heard.
coming from in that guy's diet?
Pop.
Yeah,
Pop.
soda pop.
Yeah,
That's
4
killer.
kids, and I talked to him. I said, those kids are going to do exactly what they see you
Right.
do. In fact, they're on your Silver Fluoride program.
The children are?
The children are. I don't know if he heard me. He kind of quiet, but
Yeah.
maybe I told him that if he wasn't going to change what he was creating in his mouth, he may as well kind of plan right now in his late 30s to have a denture. Because what's the point of doing all this,
Yeah. Well, I want to thank you, first of all, for filling in for me for 3 months.
Mhm.
I really appreciate that. And
Yeah.
it's been a joy to meet you,
Yeah.
and I look forward to the future. And
Oh,
you
me
never
too.
know how our lives might intersect, and
Uh-huh.
we have some adventures on the horizon planned, and
I do.
look forward to hearing about those.
Yes.
But tell me a little bit about, what you found when you came to this practice and what you saw that might be a little different than most practices, and
Uh-huh.
a little bit about what you might take away with you going forward.
Oh, what I take away is huge because it's a completely different philosophy that surprises me, isn't more common. I suppose it's the monetary thing, but since I'm into going on mission trips, then I can see hugely how it's needed in other countries. But the clientele you had down at the Shoreview practice, I don't think they're a whole lot different than the people that you meet in a third world country as far as dental knowledge and what they're presenting as far as decay. I spent the last 10 or 12 years trying to relearn dentistry and get on the cutting edge, and no one ever mentioned finding a cure for caries till I came here. And there's a sign in both private offices, and I thought, when I first saw that, my thought was, good luck. I didn't quite see how that would be, but you had mentioned that it was happening here, and then I saw it happen, and the application was so simple, and being here as long as 3 months, I got to see some people where there was actually hard decay that was arrested, basically cured, and lots of family groupings. It kind of bothered me to have the parent in the room. And then having worked here and heard your philosophy and having Leanna help me with that, the whole family is excited about it. I think only maybe 2 people weren't interested in having black teeth. I kind of felt bad for their children because then they have to get the shot, go through the drilling and all that stuff, and it's so much more simple to just solve the problem and have little smiling faces,
So
it's very good.
Do you think that silver fluoride has a future for preventing caries?
Totally, completely. arrests it, turns it hard. If it's, and it's then easy to fill because you can almost do just kind of scrape it out a little bit, put a white filling in if somebody doesn't want it to show. And the situation of treating root caries on older people or people who are unable to brush, that is just a miracle for them, because to do a denture for someone who's 85, that they will never learn how to use the denture. They're just, you know, really in a crisis as far as eating and functioning. And so to be able to treat their root caries or arrest it is just too good to be true. And as far as the children all over the world, you know, when we go to the third world country, I can hardly wait to see what you're going to do. You know, I hope that I hope it really does go like wildfire, like it does. I think there's a lot of dentists who will hear you, because I really think that, of course, we all need to earn a living, but because we're in the care of human beings, I think that's a big part of more dentists than we think, you know, as far as helping people.
What did you notice in terms of sort of our atraumatic approach to care and make the visits pleasant and happy? Did you see maybe that patients' anxieties were lower than ordinarily they would be?
Hugely, because you could say to a child, it's going to be really quick, and it is really quick. And then, you know, they only have to have the bad taste for a little while. And actually, last Tuesday, I put some in my own mouth. Initially, just a little sour, and then just bitter, but, you know, much worse things. Once a child's done it 2 or 3 times, they know what's coming, they can do it. It's, yeah, for even quite small children, because it's not traumatic, it's just like medicine.
Is there anything unique about what we do in this practice that would be hard to be adopted in other offices, or is this something that should be easily embraced?
Easy, very easy. Probably the hard thing for a lot of dentists who are in mainstream type of care would be the fast turnover. You know, they think they have to turn over a room. It goes so fast. I mean, there would have to be some design for a little more streamlined rooms as opposed to a whole full-on big operatory. It seemed like that would make it a little more functional in mainstream dentistry.
You think that this treatment approach might enable us to use expanded function auxiliaries, assistants, and hygienists to their full capacity?
Mm-hmm. Yes, yeah, there's no reason why a dentist has to do that, you know.
Yeah, because dentists are trained to do surgical procedures and do fillings,
exactly.
and we're not trying to take that away, that's important.
Right.
But we can extend our reach so much more with silver fluoride.
Exactly, reach a lot more people, and I would think that you wouldn't even have to be a hygienist, or, you know, I would think you should be able to teach your front office staff how to do that. I mean, it's not that hard a deal, of course, with a dentist's supervision. I think, yeah, that would be totally good.
How do you think this experience for 3 months is going to impact your professional time going forward?
Answers. That's my most favorite thing about taking continuing education, is finding that there's answers for so many things that for, you know, 35 years of doing dentistry, there have been a lot of mysteries and questions, and how do you solve this, and what do you do with this person that just has all this rampant decay? And now there's a solution. You know, people who are diabetic, or people, we talk about them having a genetic propensity to decay. There's a solution, which is answers. They're just really refreshing. And
so I really enjoyed watching you reading my literature and picking up my books, and I appreciate that. And so are you enthusiastic to share some of the literature, you know, with your colleagues going forward that you found here?
If they'll listen, yes, of course. Yeah.
So which one was your favorite book?
Dental Caries, the one where Edwina Kidd is one of the authors, and there's a chapter in there that literally talked about caries about 2/3 of the way through the book, and what's happening and what solutions there are, which is exactly what you have in place in your office that I've gotten to see. It's true. I'm surprised that that isn't a foremost book in every dental school. It's amazing.
Well,
Yeah.
when I started this 4 years ago, I decided to look at revisit the literature, and I did just buy every book I could
Yeah.
find on cariology and public health dentistry. And,
I noticed that.
because I think you've got to be grounded in the science
Right,
before
right.
you try something novel. So
Yeah. I don't novel. I guess it's novel, but it's really the answer. I mean, you really have found a cure for caries. Really, it's true.
well, thank you. So you think you've seen enough cases to be convinced this isn't a fluke? This
Totally
works?
convinced. It works. It's a solution. It's an answer for I don't know how many people, who don't know. If answers just set people free. If they have an answer to a problem, they can have hope and be set free instead of be in pain and
So
misery.
what do you think? Can we cure caries in Fiji?
I think so. I think so.
All right.
Maybe not this trip, but I plan to go next summer too.
Yeah.
And I'm going to do you gave me a list of things, checking with the government and whatever, and I'll do that. I'll find out how to do that.
That's very exciting to me because it's a little path that this experience and knowledge is taking outside that can potentially touch thousands
The
of
world.
people, the whole world.
The world. Yeah, there's no reason for children to be in pain or old people,
But we need people like you to spread the word. So
I'm noisy.
I congratulate you.
Thank you very much. It's a privilege.
Anything else you want to share with us?
No, it was a great experience. I
Fantastic.
can't believe my good fortune in just being in a place for 3 months where there's an answer to stuff I didn't know that we were even looking for an answer. Now I have it. It's great. Thanks
new
so much.
paradigm.
Yes.
Thank you.
That's it. You're welcome.
Awesome interview.